bronchitis, spores and pneumonia, an antibiotic which you damn well they couldn't afford to.
Hello, I thought I'd give you some facts on the National Health Service because the Americans at the moment are thinking of starting something similar. Well, the National Health Service was introduced on the 5th of July 1948 by Anna Bevan of the Labour Party. It aimed to provide free health care on the basis of need rather than if you could afford it. It is under the Department of Health, which was around at the time, and because before that they had the Ministry of Food and Department of Health to make sure everybody was well. That's where rationing came from, and people, they found, because they were rationed and only had the food that they really needed, were healthier. So the government, the Labour Party at the time, thought it would be a good idea to keep everybody healthy at the minimum cost to those who couldn't afford it. Because when I was born in 1937, there was no National Health Service, and my mum and dad had to really struggle to bring in a doctor and a midwife, and even then my mother nearly died because I was a 10-pound baby, and I nearly died. We were lucky because a lot of women died in labour in those days, and they lost a lot of children. The infant mortality rate was huge. Well, since then, thanks to Anna Bevan and the Labour Party in 1948, we all get a fair shot of staying well, whether we're young or old. Thank you.
In the year that this was made, polio and diphtheria vaccinations were introduced.
Bronchitis, spores and pneumonia, an antibiotic which you damn well they couldn't afford to pay for.